So here it is, guys. As promised, I posted a video a few days back with a upper cervical adjustment, and I was hashtagging migraine relief, headache relief, neck pain, things of that nature. So commonly people go to the chiropractor for neck pain, back pain, now hopefully it shed some awareness on frequent migraines and headaches. A lot of that stuff can originate from tight muscles in the neck, but also things like light sensitivity, chemical imbalance, whether it be neurotransmitter or hormonal. There's a lot of things to look at as to the reason why someone might get like chronic, tension headaches or migraines, and maybe not just coming from the neck muscles. But here's the thing. In the post, I wrote down, in the description or in the post, the idea was that why a chiropractic adjustment should or needs to be specific. And what I wanted to do is use an x-ray of, random, person's x-ray. Don't worry, nothing revealed that shouldn't be. And the purpose of this is to kind of give you an idea of why it needs to be specific. Now, as a disclaimer, the people that know me know that I go to non-Gonstead doctors to get adjusted. And as long as chiropractic is specific, it doesn't matter what technique you do, that's going to be chiropractic. We have to remove the nerve pressure, optimize function at the joint, and it gets even more detailed than that, but really we're impacting the neurology if we want to, make the claims that we're making to be able to do such great work, as opposed to getting the same result that a massage, might get, or manual therapy, or you're manipulating the whole spine. So again, if you're manipulating or you're adjusting the whole spine, as long as you're being specific in respect to the mechanics, then that's awesome. That's specific chiropractic. My hopes is that all chiropractors out there are practicing a specific type of chiropractic that they can get to and be able to fix the underlying problem, because that's what you deserve. As a person that is living the life with some kind of a pain or dysfunction, you need the help. You need the specific help that's going to get to the underlying cause. For the sake of this video, I'm going to actually leave out the part of inhibiting, pain receptors known as nociception. I'm going to leave out stimulating mechanoreceptors that are packed within the ligaments, more so in the cervical spine than any other part of the body. I'm going to leave out which side of the brain, based on which side of the body we adjust, may get activated or stimulated as well in regards to that aspect of the adjustment. But what I am going to do, again, is show you just with this x-ray why being specific matters so much. So right here, one of the things I just want to point out right away, I hope you can appreciate these lines going back. We call this a Gonstead line analysis of the cervical spine, your neck. And these are all pretty much even and open. And then you can see that this is the most open here as they move away. And then they begin to converge over here as they get more narrow and begin to get closer. Now, the idea and the reason I'm saying that you want your chiropractor to be specific is a common symptom or a common diagnosis that people come to the chiropractor for is a radiculopathy. And what that means is that's a referred pain going down into the shoulder, elbow, wrist, hands, fingers, for an example, from what we call the brachial plexus. And those are the nerves that come from the neck and go down and actually control your hand. That's often why something that might be thought of as carpal tunnel or a pronator teres syndrome could be a nerve that's actually entrapped or bothered or inflamed from the neck. Oftentimes a disc bulge or a disc herniation in the neck will impinge on one of these nerves, and thus impacting the motor or sensory part of the hand or elbow or shoulder. And then you would really need somebody who could adjust this area, freeing up the nerves and impacting the joint receptors in this area. Again, these discs are all open because the neck is going forward to alleviate pressure down here. If this area can't be corrected specifically, then there's just not going to be a benefit for you as the patient. You'd really be wasting your time. So again, I just wanted to make everyone aware with just respects to the biomechanics in this one example in neck adjusting. This entire thing could be analyzed when you look at a scoliosis, when we look at what side of the muscle on either side of the cervical spine or on either side of the entire spine. So from your foundation all the way up on either side, there's always going to be a stretched portion and there's always going to be a compressed portion. Again, something that the chiropractor or the osteopath or the physical therapist, whoever's doing a manipulation or whoever's going to do manual therapy, they really have to be specific in their approach to know that aspect of the fascial distortion, if you will, that aspect of the curvature of the spine, and which muscles are involved, which joints are involved, which nerves are involved. So that right there, everybody, is why you really want to make sure that you're getting a specific approach to chiropractic or a specific issue that you want to get taken care of. So guys, I hope this video was helpful. Feel free to leave a comment. Feel free to share it with somebody who you think is looking for chiropractic right now. If you found this video on YouTube, go ahead and hit the subscribe button. If you like the information and you like the content we put out, also you can go ahead and hit that notification bell anytime we come out with new material. Until next time, guys, thanks for tuning in. It's Dr. Pearlman.